Hey, Dr. Shakib here from Irvine Spine and Wellness Center, your Irvine Chiropractor and Wellness Clinic. I'm here with Desiree talking about neck pain, upper trap pain, pain between the shoulder blades, and how to fix it. So stay tuned. Thanks for watching. Let's talk about developmental kinesiology. In my practice, we do what's called DNS, dynamic neuromuscular stabilization, which is, well, you can read about it on the website. This video has to do with one specific pose that strengthens the triceps, upper trap, between the shoulder blade muscles, rhomboids specifically quite a bit, and all the shoulder blade stabilizers, which are so important, because when they're out of whack, you end up with so many problems. And really, they're out of whack in everyone thanks to our sedentary lifestyle. So in this pose, this is a later phase of a 3-month-old prone or on the stomach exercise. So what we do, and pay close attention, maybe you want to rewind this a few times to make sure you're doing this correctly. So the hand placement is very important. What you want to do is you want to spread your fingers nicely, and let's put it under the towel here so it's done right. And we're going to keep the fingers nice and spread. The hand is touching the ground in the whole palm of the hand. The shoulders are externally rotated, not because you're sticking your chest out, but you're simply activating, just go ahead and relax this, you're simply activating the muscles here to bring your shoulder back to a neutral position. You want to relax this, not force that. The line of drive, the line of push is going to be with the elbows pointing downward with the intention to go downward towards the floor while you're pushing into your hands. So the elbows will go in the downward direction as you go through this pose, and we're going to show you what that looks like as you're pushing from the elbow into your hands to get you up. This exercise cannot involve your upper trap, and that's very important. It cannot involve the lower back, it cannot involve the glutes or your legs, and that's typically where we find most people go wrong. So the first thing first is to position the hands there correctly, as I explained, and then the head, you're going to activate your neck muscles. This is not a head up, it's a neck and head together lifted up to be at the same level as the spine. That's crucial. Now you're gonna keep the back, the upper back, as if flat, as if you're serving, I always say hot tea. You can't spill the hot tea, that's gonna hurt. So you're gonna be positioning or pointing or having the intention of your elbows pressing down towards the floor as you're pushing the ground away with your hands. So go ahead and lift that way and push and straighten your elbow there. So we can go down, beautifully done. The mid-back, the upper mid-back has stayed flat. I don't really want you guys to go all the way up like Desiree did. Desiree has witnessed a lot of exercises we do with the patients, so I was okay with it, but there's prelude to that needs to be done. The point here is not to involve the upper trap to lift you up. Can you do it incorrectly so people can see? Can you engage? So you see how she's using the upper trap to lift herself up? You don't have to finish. That is incorrect. You will notice your triceps is a lot weaker than you realize, and also realize how much of the upper trap you end up using for a movement that's not even the upper trap movement. When the upper trap gets tense, that's all of this. It really does a lot of damage A lot of headaches are as a result of that. There's a lot more that goes with that package. Thank you so much, Desiree. Anyway, if you liked what you saw, please check our website out and shoot us any emails or call the office with your questions. Subscribe to the YouTube channel, and do know that no question is a silly question. So as long as you're on the right track, that's more important than never starting because you're afraid you're not going to do it correctly. Finishing a move is not important. Doing a move even halfway, but using the right muscles, is the right way of looking at exercise and movement. Thanks for watching. Take care.